everybody. I'm Kim Benner, and I am a professor of pharmacy practice at Samford University McWhorter School of Pharmacy in Birmingham, Alabama. But my pharmacist job is I'm a pediatric pharmacist, and I work on the pulmonary floor at Children's of Alabama. So I began my pharmacy journey by getting a degree in Bachelor of Science in Chemistry and Biology, and then I went on to pharmacy school. And when I graduated pharmacy school, I knew I wanted to do a little something different. So I did a residency in pediatrics at Children's of Alabama, and then I decided to go into academia. So I was hired by the School of Pharmacy I'm still at 26 years ago. And so I profess as I teach, and I also practice at Children's. So I decided to go into pharmacy because I always knew I wanted to work in healthcare since I was about 15 or 16 and volunteered at a children's hospital. And I knew I wanted to be in pediatrics somehow. I thought about being a pediatrician, but I was very interested in how medications worked. So I decided to go to pharmacy school, and then after that I did choose to do a residency in pediatrics. And so practicing in pediatric pharmacy at a teaching hospital really seemed to be the thing that fit my skill set the best and kind of was the perfect fit for my career choice. So a typical day for me is probably not very typical for a lot of pharmacists. So since I am a professor but I have a practice site, I actually go to Children's Hospital every morning where I take pharmacy students with me to practice, to model the practice of pharmacy on my floor at Children's. And I get to work with medical students and medical residents and attending physicians and fellows and help teach them about how to appropriately use medications. But I also get to take care of the kids there at the hospital, which is really great. And so then in the afternoons, I go to Samford. I usually teach there and or I spend time with students mentoring or advising the future pharmacist. So I have several probably favorite parts of my job. Working with children is the most amazing experience. It's hard to believe that a children's hospital is actually a fun place to be. The children are very resilient. We're always having parties. We get to, one day I went in and we were hula hooping in the hall, and we have send-offs for our kids that get to go home, and we have ice cream parties, and it's usually a really fun place to be. So I really enjoy being around the children and making a difference. It's really nice getting to practice pharmacy at a teaching hospital because the physicians that I work with are very eager for pharmacy to be a part of the daily medical team round. So it's a really good way for me to practice pharmacy, but also to model the profession of pharmacy for my students. But the other favorite part of my job that has to do more with being an academician is working with students. I really love to help mentor students and help prepare them for a future in residency training, even typically pediatrics, but just whatever their chosen field of going into pharmacy is, because pharmacy can be so diverse. So I kind of help mold them and guide them down the path of pharmacy. So the advice I would give for young folks looking to think about pharmacy as a profession is, first of all, to think about, do you want to help people? Because generally people who go into medicine want to help people. And so that's a great place to start, is kind of where your heart is and what you want to do. Sometimes people say if you love chemistry, pharmacy is a good profession, which I agree with. But if you don't like chemistry, that doesn't mean pharmacy is not for you. I personally love biology more, and so we do a lot of math. So chemistry, math, and biology are important areas to be interested in, at least to go into pharmacy. But just generally wanting to help people is really what we look for in future pharmacists. And so I think the biggest piece of advice I give people, because I mentor a lot of students who are looking into pharmacy, both before they've chosen it and after they've chosen pharmacy as a path, is to shadow someone. There's a lot of pharmacists out there, so ask if you can come shadow them at their hospital or their community pharmacy and kind of see what a typical day for them is like, because most of us are very eager to show off our great profession.